All right, so let's talk about another clinical application of another type of what muscarinic agonist drug. Okay, and we said that the muscarinic agonist drugs, they are drugs that when they bind to the muscarinic receptors, they'll activate it the same way acetylcholine is activating it. Okay, or they could have an indirect action of just making sure that acetylcholine is in excess. Okay, so one of the drugs for that were listed in muscarinic agonist was what carbachol, and I would like us to actually talk about the clinical application or uses of this carbachol. We've spoken about butanacol and we've spoken about pilocarpine. Pilocarpine is used for mostly for glaucoma treatment. Butanacol is used mostly for urinary retention, gastroparesis, to increase gastric stimulation and all that. So let's talk about carbachol now. You can see carbachol too. You can see the drew an eye, so carbachol should have an effect on the eye too. Okay, it has effect on many systems. Okay, it has effect on many systems. So let's talk about it. Carbachol can act on muscarinic receptors and nicotinic receptors. These are receptors for acetylcholine. So clinical applications now, it can be used to treat what? Urinary retention. Okay, that's like if your bladders are retaining urine more than the normal and the problem is not obstruction. So you might want to actually give carbachol to stimulate the muscles there. They can be used to treat what? Paralytic ileus too. It can be used to treat what? Glaucoma, right? And in glaucoma, it will decrease what? Intraocular pressure by opening drainage angle of the anterior chamber of the eye. So now, when resistance occur with pilocarpine, because pilocarpine can be used to treat, it can be used to treat what? Glaucoma too. And okay, basically they are saying that the carbachol can be used when resistance occur with pilocarpine or physostigmine. Okay, so it is also used mainly in what? Ophthalmology in cataract surgery. Okay, it causes rapid meiosis, right? So when you are doing cataract surgery, you might want to administer this drug. Okay, so it has a selectivity of activity of all actions. All right, it acts only on the urinary bladder in treating what? Urinary retention. It acts on the gastrointestinal tract, on the paralytic ileus, and acts on the eye in treatment of what? Glaucoma. Right. So see, this is what glaucoma, pressure in the eye. Okay, so to basically what? Decrease the pressure. And what is the mechanism of action? To open drainage angle of the anterior chamber of the eye. Okay, and in paralytic ileus, we say that paralytic ileus is a partial or complete non-mechanical blockage of the small or large intestine. Okay, so if there's blockage in the small or large intestine, you basically want to what? Um, it's a non-mechanical blockage, all right? So it's due to maybe the muscles, all right? It's not something physical that is blocking it. So you want to relax the muscles so that digestion can go on. And this is urinary retention. Urinary retention, this is normally your urine should be like this. So if you have urine being kept back in the bladder for a longer time or longer or higher volume, that's what we call what? Urinary retention, right? So that's it about what the clinical applications or uses of what carbachol drug. Right, so see you guys pretty soon.